Why do fibromyalgia patients experience hyperacusis? Imagine hearing everyday sounds like a whisper or a distant hum and feeling overwhelmed or even in pain. That's what hyperacusis feels like for many with fibromyalgia. This heightened sensitivity to sound is not just in your head. It's rooted in how the nervous system processes sensory information. In fibromyalgia, the central nervous system, which includes the brain and spinal cord, becomes more reactive than usual. This condition is called central sensitization, and it causes the brain to amplify sensory signals, making normal sounds seem much louder or more uncomfortable than they should be. Fibromyalgia is known for causing widespread pain, but it also affects how the brain perceives other sensations like light, smells, and sounds. This increased sensitivity is linked to changes in how the nervous system handles sensory input. Normally, the brain filters out unnecessary stimuli, but in fibromyalgia, this filtering process is disrupted. As a result, sounds that are usually tolerable can feel painfully loud or irritating. This is because the threshold for perceiving sound as uncomfortable is lowered, leading to hyperacusis. Research shows that in fibromyalgia, the brain's mechanisms for processing sound are altered. The brain's auditory pathways become hyperactive, which means they respond more strongly to sounds. This is partly due to an increase in what scientists call central gain, a process where the brain boosts the sensitivity of auditory neurons to maintain hearing across different sound levels. When this gain becomes dysregulated, it causes an overamplification of sounds, making normal noises seem excessively loud or even painful. Additionally, people with fibromyalgia often experience a hypervigilant state, meaning their nervous system is constantly on high alert. This heightened state makes sensory inputs, including sounds, more noticeable and more distressing. It's similar to being overly sensitive to pain or light, which are common symptoms of fibromyalgia. The brain's increased attention to sensory stimuli means that sounds are not only perceived as louder but also more intrusive and difficult to ignore. In practical terms, this means that fibromyalgia patients may find everyday environments challenging, especially noisy places like busy streets, restaurants, or crowded rooms. Managing sensory sensitivities involves working with healthcare providers to develop strategies that reduce exposure to triggering sounds and create a more comfortable environment. Recognizing that hyperacusis is part of the broader sensory hypersensitivity in fibromyalgia helps in understanding and coping with these symptoms. Remember, each person's experience is unique, and it's important to seek personalized medical advice to address these sensitivities effectively.